Hi, I'm Chit.
And I'm Harlow. And even if you haven't watched Grey's Anatomy, I'm guessing you've heard of the drama series that depicts healthcare workers in the OR, emergency room, and surgical center. But have you ever wondered how those healthcare workers got to that spot in the first place? We would like to introduce to you St. Luke's first operating room simulation lab called SkillSurge.
Many of us have probably seen or heard of a simulation room online, but never seen it in person. The overall purpose of a simulation room is to have immersive, hands-on learning skills for our healthcare students and workers. It also provides realistic scenarios for different emergencies. It also increases patient safety. It minimizes risk and mistakes in a healthcare setting.
The problem is that St. Luke's health system doesn't have a simulation lab designed for the operating room. And because of this, healthcare workers don't have a space to participate in simulations to give them practice before they go into an emergency. More than 4,000 surgical errors happen annually in the U.S. alone. And the healthcare experts we talked to said a simulation lab would significantly decrease this number.
Our solution is SkillSurge. This summer, we had the opportunity to shadow clinical education specialists at St. Luke's Health System in different departments. We also had the chance to witness a trial run of their first OB Sim lab. This was a really eye-opening experience as we saw how beneficial this Sim lab was. When talking to clinical education specialists, they deeply expressed the need of an OR Sim lab. And this can be really impactful for their training and also gives hands-on experience. SkillSurge will be operation room focused. Operation rooms are where surgeries are being held and lives are being saved. It takes a whole team to run an operation room. SkillSurge will allow workers to work together, be familiar with different scenarios, and learn without risk. It will also help fill learning gaps. Different scenarios can range from skill progression in appendectomy or cataract surgeries. SkillSurge will be delivered to all different scenarios.
We have included a picture of what our simulation lab might look like, and we've budgeted $2 million for our sim lab. We plan to get these funds from St. Luke's donors, similar to how the OB simulation lab got their funds. Some examples of what this money might go to is equipment for surgeries, such as an anesthesia machine, a surgical table and light positioners, and an endoscopy tower. Additionally, we would include microphones, screens, and cameras. That way we can have clear communication between the participants in the lab and the control room. We would also like the control room to be raised. That way the specialists and educators in the control room can see clearly into what the participants are learning. And we would also like one-way glass. That way the participants don't have to stress and worry about what is going on in the control room, such as note-taking and monitoring and stuff like that. We would like this experience to be completely immersive. We also plan to save a little bit of money for this sim lab, as we would use the already existing St. Luke's campus at the Rockers campus. That way we wouldn't have to construct an entirely new complex for this lab. We also know the importance of community, which is why SkillSurge wouldn't just be catered to healthcare professionals. SkillSurge would offer school-sponsored days for students interested in healthcare to get hands-on experience with surgical procedures. We as students got the opportunity to intern and scrub in at an OR and see the experience of what nurses and surgeons go through in an operating room. And we would like that experience to be outcast to students in the Kansas City, Missouri metro area, which is why we allow SkillSurge to be open to the public and for students to come in and experience it in OR.
Our next steps are seek funding, incorporate the needs of St. Luke's Health System, and also receive feedback. We would like to also connect to our healthcare providers and community and high school partners. Thank you for listening to our presentation today. We'd like to thank the St. Luke's specialists for making this opportunity special. As future healthcare professionals, we can use this as a stepping stone to strengthen healthcare. Thank you, and let us know if you have any questions or concerns.